of the global healthcare data today goes unused because they are siloed. So there is a big opportunity in there, and our Excellency Dr. Noura shared about the challenges that healthcare is experiencing today. But technology has some trends which can enable when it comes to precision medicine, right? The first one is to modernize care infrastructure, because the data are unstructured and it is difficult to query and analyze those data, right? The second one is to accelerate the diagnosis by having a modern data strategy in place. It's not just about having the data, it's around having the data strategy. And this can lead also to build the population health and having the knowledge of those health population data can help policymakers and health systems make data-driven decisions and therefore build healthcare more and make healthcare more accessible. So when it comes to accessible data leads to accessible healthcare.
So you basically say have proper data strategy, right? Make sure you're using the data in the right manner. So Dr. Sanji, what is your view from a product provider perspective? I know you've been working a lot on health information exchange, there's a lot of different data sets. Is the data in the right shape today to make it more usable? What's your view from a clinical and provider perspective?
Sure, so thanks Rauf for the opportunity to be here. Certainly I think the data is in the right state, as was shown quite clearly by Dr. James before. The volume of data that's been captured and the capability technology-wise to capture that data is significant. It's there, it's already used. And at MALAFFI we've already taken steps. I'm focusing specifically on wearables data. We've started to capture vital sign information both from consumers as well as from facilities. But the key there for us has been standardizing that data in a way that it can be used. So we've kind of white-coded certain key parameters, which allows standardization, ensures data quality, and then allows that data to be used at scale to provide data-driven insights to physicians, the regulator, and also to, in the future, train AI and ML models on being able to provide more predictive insights as to patients' outcomes and future. So certainly the data, I think, is ready. One of the key, as you mentioned, the number of wearables that are out there available to consumers is now having trust in, are these devices accurate? Are they going to be regulated in some way? So that as a physician or even as a consumer, I can trust in the data that is being captured and therefore the actionable insights that are being provided to you. So I think the regulator will have a significant part to play in identifying which wearable devices can be trusted and could be used in the different opportunities we have to improve healthcare.
That's great, thank you. Corey, here's a question for you.
Yeah.
We're talking about tons and tons of data, like Asma joke. And really you can't get the value of this until you use it properly, and I think Juli and even Dr. Sanji mentioned. But how is the clinical community accounting for all the time and the resource and effort they need to make sense of this data, to actually use this data from wearables in actual practice?
Yeah, thank you, Rauf, and thank you to the Ministry of Health for having us here to this exciting event. Wearables, it's about, I think the answer here is about how do we operationalize and really effectively integrate this valuable data. And so I'm here representing the American Medical Association, which is a 175-year-old nonprofit physician membership organization that has been focusing a lot on standardizing the practice of medicine and advancing our mission of promoting the art and science of medicine and the betterment of public health. And one of the ways that we advance that mission is by convening a set of physician stakeholders from all the medical specialties and other payers and hospitals and policymakers to create a code system called the Current Procedural Terminology, or CPT, which effectively creates around 11,000 concepts to represent all of the work that physicians do and clinicians do, and associates each of those concepts with quantitative data that tracks to the minute the clinician time and other practice resources that are needed to deliver care. And this code system has been around since 1966, and we actively keep it up to keep track and keep pace with all of the new modalities and care methods, including integrating remote physiologic monitoring, wearables, etc. And so this really then allows, as these exciting technologies get integrated, we start to associate these codified data with the services that are delivered to use that data. That allows us to then use to quantify, whether it be part of value-based care or fee-for-service models, how resources are being used in the delivery of care.
That's great. Professor Asma, you've been at the forefront of pediatrics. How do you think wearable sensors, connected devices can be used and leveraged to promote health in the pediatric population? Do you think, are we seeing the next shift in pediatric care through wearables and sensors?
Thank you very much, Rauf, for the question, and my sincere thanks to DOH for this invitation. It's a pleasure to be here and contribute to this panel. Pediatrics or child health, we believe in holistic approach for treating those youngsters. And by holistic approach, I mean it's not only treating body, but also healing soul. So we do care very much on not only treating the disease, but also looking at ways of improving quality of life. And I'd like to take diabetes here as a model or as an example to answer your question. Diabetes is a very complex disease, particularly in youngsters, where they have to prick their fingers 5, 6, 10 times a day to look at blood sugar, which fluctuates up and down, and they have to inject themselves with insulin 4, 5, 6 times a day. So innovation and technology came into the rescue. And I'll give you 2 quick examples on how that happens. Continuous glucose monitoring. We've heard in the introductory talk about the innovation of the technology. So nowadays, instead of parents losing sleep, I know of many mothers, fathers as well, to be fair, losing sleep because they are thinking about what's happening to their children, what's happening to the blood sugar when they are asleep. Nowadays, we moved away from pricking fingers, inflicting pain to those youngsters, and using digital smart patches for continuous glucose monitoring. That will not only give parents the remote control of their children's glucose levels, but also it helps them for this smart connectivity, the remote monitoring, and peace of mind. The other area is the innovation of insulin pump therapy, which is, again, another form of wearables, where people stop injecting themselves with syringes, but use these smart devices. And finally, it's not only monitoring and being reactive to what you see, or injecting insulin, but also, very important, to be proactive. So these smart devices utilize predictive algorithms and models where it gives you, in a small smart screen, trend arrows, so that will predict what happens to the child if he or she wants to go to swim or to eat extra. So it's an overall package of innovative solutions where it contributes to treating diseases, but also improving quality of life, patients and families alike.
Yes, we're saving lives. I think when it comes to children, all of us parents would love to see these, right? We said that every parent is worried about what's happening to a sick child. There's tremendous amount of innovation happening in this space. Right? We read about this every day. I think Dr. James touched on a few things. And also, I have to say that wearables have been at the center of clinical research. They've been at the center of boosting new products to come in, new medicine to come in faster for diseases. I'd like to ask Rudi, what do you think, or would you like to give us some insights on innovation around using wearables in clinical trials that's happening globally?
Thank you. And if you analyze clinical trials or inventions in wearables, remarkably, most of the time people publish on the successful cases. but we can learn so much more from the failures, and there are sometimes epic failures that those untold stories. And we can learn also from other regions and from other trials. And there is a vast amount of clinical trials ongoing involving wearables. And that is, of course, the cardiovascular area. We have seen that in the previous exhibition from biointelligence. That is one of the most promising things. But there are also areas when it comes to support clinical decision support or to fight dark matter. We talk about artificial intelligence. But what people are not aware that most algorithms fail in clinical routine, to be honest. And that is because we train on acute hospital data. They cover 1 out of 5 medical incidents. So now wearables focus to explore this dark matter. That happens especially in cardiovascular diseases, in stroke, and these are the areas where a huge amount of clinical trials involving wearables are ongoing because there is that strong clinical need. And what is a little bit left behind, but could be quite well improving the healthcare system, is the telemedicine thing to find out how can I improve the adherence of patients to a therapy, to a regime. Because, to be honest, quite often it happens, patients simply do not follow the prescription and the rhythms, and there is a huge amount of clinical trials to find out how can we support the patients to stay adherent, and that saves money and it saves lives. But these are more often the less, let's say, fancy narratives. So everyone comes with an AI that successfully did something, and that has a telemedicine wearable that improves the adherence. There are many trials, but they are maybe not selling so good. But if you do a scale of the landscape, these are the hotspots where I would recommend that makes sense, that has the real world implication, that is a low-hanging fruit right now.
You talked about some of these things, AI, ML being, fancy things. I'd like to ask Dr. Sanji, if you look at AI, we talk a lot about AI, I think that's trending right now in the GPT-4 review is happening this week as well. I wanted to ask you, is AI related to connected devices, remote PA, all of this, is it for real? Or is it, because you need a lot of data in this, the data that's standard, consistent. Is it for real? What kind of impact is it having? All the things that we've heard, these are hypothetical, right? We haven't really predicted as much as we imagined it to do. So I'd like to get your thoughts on AI and ML surrounding the wearables.
Sure. So I think, the recurring theme, certainly in this inaugural conference, has been all about preventative care, managing patients outside of the facilities, only bringing them in to these expensive facilities when you need to provide or undertake certain invasive procedures or invasive investigations. So that's going to rely a lot on capturing data virtually right through wearables, continuous monitoring devices, and so on, and having a trust in the information that's been captured to support clinical care virtually. And I think AI is going to have a huge part to play in this, and there have been several sessions at the M42 stand already talking about precision medicine, utilizing artificial intelligence to better predict outcomes or patient outcomes, looking at trends so that there could be early warning signs or early alerting to clinicians who are managing patients remotely. But as you rightly said, these models need to be trained. We need to be confident that they're going to provide accurate information that can be trusted. And I think there's still a lot of mistrust in the physician population that these things work, and I think it's going to take time. And also having physicians involved in training these models, or clinicians involved in training these models, is going to build that trust. But certainly I don't think there's any disputing that AI is going to be a mechanism of improving efficiency in terms of care delivery. Being able to predict when a patient might be deteriorating when they're at home, even looking at simple things like how can you predict or know when someone's had a fall, an elderly person, because perhaps the monitoring devices are not capturing that information that they were expected to capture in a meaningful way. How do you now incorporate genomic data to better track or personalize the tracking of a patient condition? So you can start utilizing sensors and wearable devices, coupled with genomics to have a more targeted tracking mechanism for certain people, because you know they may be at risk of certain conditions. At MALAFFI, we've already implemented some predictive analytic tools based on AI and machine learning, and the key for our physicians was transparency. Why are you predicting someone is having high risk of developing CHF or hypertension or diabetes? Give us some insight into what the contributing factors are so that I can be more confident in the AI tool that's being used to present this data. So definitely I think that we have a long way to go. We're in our infancy when it comes to AI and trust in the system from our end users. But certainly I think the opportunity and the potential is significant as these models continue to develop and become more mature.
Yeah, absolutely. I couldn't agree more. Juli, I think we were saying there's a long way to go with AI and artificial intelligence and machine learning, but how is technology really boosting that use? But how is it helping us, enabling us to make better use of data of these sensors and connected devices for better healthcare? Any thoughts on that?
So first of all, as a company, we have always believed and shared the excitement of the customers around artificial intelligence and machine learning. But I think when it comes to wearables and precision medicine, it impacts in two sides. On the patient side, that Dr. Asma shared, it's not just about measuring the vital parameters, right? It's making them engaged. So technology and machine learning right now is already helping them to adhere to the medical clinical protocol, right? Because we want them, especially in chronic conditions, after a certain amount of time, patients feel tired to do the same thing every day. And hence, for instance, with one of our partners, one example of a clinician in Australia, we are already helping with machine learning, how to cope, helping them to be engaged. I think the newest generative AI will empower them more, but because patients will have more information, and therefore we feel more engaged to manage their health, which is what we want to do. On a clinician perspective, many of us highlighted today that we have a shortage of the medical workforce, right? Here the technology can help in efficiency, the time of the clinician, right? Again, another example, this is technology. One of our partners is helping Houston Methodist to leverage AI. They distill the data directly from the EHR. That's where you have the integration of the data and the operating systems of the hospital. And they can leverage it to predict the discharge. They do a summary of the clinical notes. And that's where the clinician gains some efficiency in day-to-day. I think this is powerful.
It is indeed very, very powerful. Professor Asma, from your experience in endocrinology, what do you think makes diabetes a disease model for utilizing wearables in digital health?
That's an amazing question, actually, Rauf. Thank you very much. Diabetes, if I'm asked to choose a single disease where digital health is best applicable, I'd say diabetes. But you might think I'm biased, being a diabetologist. The reason why I think so is because diabetes is a common disease. There are around 450 million people around the world with diabetes. That was in 2017, and this is predicted to double by 2045, I think. And it's unfortunate, but UAE is scored one of the top 10 countries in the prevalence of diabetes. If we talk about health economics, it's a very expensive disease to treat. In the MENA region, around 39 billion are spent to treat diabetes every year, and I hear from latest statistics that around 37% of market share in wearables comes from Saudi Arabia, for example, and from the Gulf. So what I'm trying to say is it's a common disease, it's an expensive disease, and more importantly is diabetes is a disease of numbers, and numbers is what generate data. I'll give you a quick example about one normal standard day in my clinic. Let's say that in a full day clinic I'll see 15 patients, 1-5. And all these patients are wearing wearables, sensors. The sensor will give you one time point of glucose every 5 minutes. So if I'm seeing these patients every 3 months, I make the sum 1 day. In clinic, I will be faced by 31,650,000 data points of glucose that I have to interpret in clinic, having 20 minutes per patient. So what I'm trying to say is application of these digital solutions transform this mess of data. I know data is gold and data is silver, but data is useless if we cannot access it, if we cannot interpret it, and if we cannot utilize it wisely for the benefit of our end users or the customers. So what I'm trying to say is converting this rich data by these digital solutions for the benefit of patients as well as us, healthcare professionals, because it will save us time, it will enable us to give the perfect solution and decision making for the sake of those patients.
That's fantastic. Rudi, you've been doing precision medicine for a while. Do you have any insights about combining biomarkers with new sensor technologies and artificial intelligence? Any tips or insights in that space?
Yes, there is one special thing that has not yet been recognized in the public, but if you once again analyze cohorts or clinical trials or first approaches to get commercial, that is saliva. That is really surprising, but there are many new sensors on the way on all kinds of liquids, but especially with the saliva thing, as it is easily accessible, that is, let's say, still an insider too. And now I could go through a long list of sensors that are under development. Some are already in phase, some are already, let's say, not yet commercialized, but I have some insights they will come. And that is such a remarkable data class because in the past it was difficult to get that thing under control. It was complicated. People most of the time when they talk about a biomarker, they think, oh, that is a ground truth, but not even genetics is a ground truth. You sequence that short reads or long reads, the same genome, suddenly you have some kind of differences. So that was also the problem when it comes to that. But these sensor technologies combined with that, let's say, biospecimen, that I would consider as a future insight that could lead to surprising new insights and reduce also the noise because we can't always pick plasma from the participant or the patient.
Excellent. So we should look forward to some new biomarkers coming up from your institute.
I try to evaluate.
One of the biggest concerns we've heard about wearables relates to privacy and trust. I think Dr. Sanji touched upon that as well a while ago. And I read a survey recently which suggested that many consumers who were using wearables were ready to share information from the devices to their care teams, clinical teams, but only a small percentage of physicians were actually using it. I know Professor Dave just talked about data being overwhelming to be usable, but also there is an angle of trust, right? I'd like to ask Corey this question. How do clinicians know they can trust available data in a way that is of sufficient quality that you can use it in clinical decision making? Because if it's garbage in, garbage out, like they say.
Yeah, exactly. Thank you, Rauf. So, establishing trust in data and systems, for that matter, is a layered approach. And in the case of wearables, we have to start from the source, right, all the way up to the device. So, can we? One of the things that we focus on is again convening experts, clinical and technical experts, to establish criteria by which to validate devices. So, our devices, starting from the source, are they clinic? Can they have the capability and sensors to generate clinically valid data? And then engaging independent third parties to apply those criteria to assess devices. I don't think we can always trust the manufacturers to tell us that their devices are valid. We need to establish independent review of those devices. So once you establish that the device is valid, then we have to start kind of working our way toward the use of that data. And just another such example is, can we then confirm that the data being exchanged from those devices to the systems where that data will be used can be understood when it is, when it arrives at the system, like an electronic health record. And there again, we focus a lot of time and effort on development of infrastructure and data standards to capture a unique device identifier so that we can validate upon receipt of that data that it is coming from a valid device, and the data, the payload, if you will, in that data that's being transmitted, whether that be exercise data or steps, that data can be understood by the disparate systems that are receiving it. And there again, that all relies on data standards that we also invest in, like HL7 FHIR and other sort of global interoperability standards.
Rudi, can I ask you a question? Any thoughts on or insights that you might be able to share with the audience on how different health systems are governing the use of data coming from wearables? Is there a governing practice in place already?
So that is a surprisingly heterogeneous landscape. So, talking about the wearables, in the end, we are talking about telemedicine, nothing else. And telemedicine, of course, there is the sensor, then there's a kind of insight, and then there is a response from physicians, for example. In that triangle, you need regulation and you need experience. And some countries, you simply, so like the food, I like especially the Nordic countries in Northern Europe, where you can really learn a lot. I mentioned failures. They had epic failures, but they had a really interesting regulatory landscape, also integrating sensors and also integrating that telemedicine thing. Because in the end, the sensor only makes sense if there is medicine as a consequence. And Australia might be something interesting to dive into that regulatory regime, or Denmark. And then there are other countries all around the OECD, like we stay in Europe, where there is half a regulatory regime, half not. Even in Denmark, there are various authorities. If that is maybe like this two, I don't know. Austria has nothing, for example. And if you go through that, it's like a matrix. They have telemedicine, they have wearables. Sometimes wearables are more or less regulated. Many wearables try to avoid regulation, not being a medical device. Honestly, I would always opt for the medical device thing for data quality, otherwise you have too much noise and you have intoxicate your data set for your machine learning and AI. So there are some hotspots, and my recommendation is just to grab the Nordic countries, add a little bit Australia, watch around to smaller countries, and then copy and paste together. Many wins are already important. And then you already see what they have as success and as failure. And in my opinion, most of the time, medical devices like the biointelligence before, they provide the necessary data quality. And the consumer thing, honestly, given the experience of previous cohort, you can screw everything every cohort with noise. You go for a medical device if you summarize the experience of all those healthcare systems in variable and telemedicine regulatory regimes. And I think a medical device also is helpful to get physicians make them buy in the whole thing, because there is something going on.
I think it's a fast evolving space, so regulations need to evolve in the same manner, right? Juli, I'd like to ask you, I know you've been involved in remote care. I read from your profile that you were looking at remote surgery as well. So that involves a lot of sensitive data transfer, right? So what security mechanisms are in place from a technology perspective to strengthen the trust in the clinical and patient community about the use of wearables?
That's an important one, and I'll share our experience as a company. To us, the security is our top priority. We have invested in building those plus 100 security services. But when it comes on how we manage the security of the data with customers, we call it a shared responsibility model. So we are responsible as the cloud technology, but our customers are building the security of the cloud. But our customers are responsible for the security in the cloud. And I think that has been proven successful through time in how to manage security together.
Dr. Sanji, in practice, what are some of those challenges that you faced when assembling a health information exchange from a governance perspective, especially? Because there's a lot of concern when data moves around for people, even for data owners to even share data in a central repository. So, what are some of the governance challenges you faced?
So, I think we were very fortunate that we were able to work with the regulated Department of Health in defining a data governance standards policy before we even started embarking on MALAFFI. That was one of the key things we needed to consider, taking into account patient privacy and security, but also when we're exchanging data, making sure that we comply with the regulated standards when it comes to that, encrypting the data in flight when it's stored, making sure that we don't compromise on patient security when it comes to data. So there are very clear and strict guidelines from the DOH, not just in terms of capturing the data, but then the use of that data as well. But bearing in mind that if we want to develop and deploy products that are specific to the region, and we have a very unique mix of demographic mix in the UAE and in the GCC, as we all know, we need to be able to train these AI models so that they eliminate certain aspects of bias based on our population demographics. So we are going to utilize that data in some way, but also ensuring that we maintain security and the confidence of our patient and consumer population that their data is not going to be misused. And this has been a key premise right throughout the deployment of MALAFFI, and we continue to revisit the policy with the regulator, because obviously things change and the need for the use of data will change with it. But yes, we are very fortunate to have that already in place, but it's something that will continue to evolve.
Fortunate, yes, very fortunate indeed. Because I've known other systems that have been trying to do this and they get stuck because of all of these governance challenges. I'm very conscious we've been talking a lot from our perspective, which is the clinical community perspective, the provider, the manager, the technology perspective. But I think what's important is that wearables are centered around patients themselves. Their perspective is also very, very important. I read a recent article from the American Heart Association that says those people who need wearables the most use it the least. That may be changing, but that's an interesting insight. So I'd like to ask Professor Deep, what is the patient perspective on wearables and how can we make them more engaged in this whole new technology-enabled era, if you might call it?
Yeah, absolutely. That's a very good question and a very important area, the area of engagement. Because we do sometimes tend to blame patients being non-adherent, and we don't look at ourselves, how concordant we are in making them adherent. But to be honest, as an opinion from a pediatrician, I find that an easy task. And the main reason why I'm saying it's easy is we find it very easy to sell technology to youngsters. They are technology savvy, they are more often than not far better than us with our generation knowing the technology. So we see these youngsters coming to clinic having searched already, having looked at the updates and the advances and the application. And just going back to numbers, from statistics, UAE is well known for being one of the highest number per capita of people using smartphones and smartwatches. And that paved the way for us, clinicians, to persuade. We don't even need to persuade. People nowadays are taking it out of, without a question. And let me go back to finalize my answer about engagement, is just hinting to culture sensitivity and the application of the technology. I'll give you a very quick example that I find highly applicable on how to enforce engagement for these people. Think about the traditional wear here in the UAE and the long dresses. And previously with insulin pumps and continuous glucose monitoring, people need to access physically their devices. So if a child's coming with a crop top or a pair of jeans, it's easy. But if a person is coming with a traditional dress of abaya or kandura and then applying this remote control system and having the perfect technology yet with things being unrevealed, is extremely important. That will encourage people to feel comfortable. They still apply the technology, yet they are keeping their decency and they are obtaining the benefit of these high accurate devices. So before we think about engagement, we need to find the root cause of why people are not engaged and they are not complying. And these two questions are, these two examples should be in the back of the head of clinicians to enable these youngsters to be engaged.
I think patient engagement is a science on its own, right? I think it's pretty deep. But thank you so much for your insights. I think we're on time. I would have liked to give the audience an opportunity to ask questions, but unfortunately, we had only 40 minutes. I know 40 minutes is very little time to talk about something as significant and as fundamental to tomorrow's healthcare as wearables and sensors and connected devices. But thank you very much, Dr. Rudi, Dr. Sanji, Cody, Professor Hysenbell, and Juli as well. Thank you so much for your time, and I hope everybody's enjoyed this. I encourage the audience to please connect the experts during the rest of the conference. And thank you so much for your attention.